Hi team, and welcome to another explainer video. Today we're taking a detailed look at a topic that seems to come up time and again in the dental profession, and that is understanding the differences between sulfur, sulfur, and sulfite allergies, and their implications for the use of local anaesthetics in dental treatment. In this video, we'll have a look at their chemical structures, uses, and most importantly, what you as a dental professional need to be aware of. By the end, hopefully you'll have a clear understanding of how to manage the situation when your patient says they have a sulfur allergy. Now, despite their similar names, sulfur, sulfur, and sulfites are quite different. By the way, they are all now spelled officially with an F, not a PH, in accordance with the Australian Therapeutic Goods Administration approved terminology for medicines, which follows the World Health Organization naming system, which quite frankly I really find hard to do after spelling it the old way for decades, but let's move with the times and use an F. Let's start with the element sulfur, S-U-L-F-U-R, which is an essential element in the human body. It's found in amino acids, vitamins, and enzymes, which basically means you cannot be allergic to elemental sulfur itself. An allergy to sulfur would actually be incompatible with life, since sulfur is a fundamental part of human biochemistry. Sulfur, often historically referred to as brimstone, which comes from the ancient times and means burning stone, has had many uses throughout history. The ancient Greeks used sulfur as a disinfectant to cleanse homes and public spaces. The Romans used sulfur in treatments for various skin ailments. And the Chinese used sulfur to develop gunpowder in the 13th century. And in the Industrial Revolution, the demand for sulfur soared when it was used to make sulfuric acid. Now, in dentistry, the main sulfur-containing drug we use is the local anaesthetic articaine, which contains a sulfur in the thiophene ring. However, it's safe for patients with sulfur allergies. The sulfur in articaine does not cause allergic reactions. So to make this clear, if a patient states that they have a sulfur allergy, you can safely use articaine as a local anaesthetic. So that's sulfur. Let's now take a look at sulfur drugs, or sulfonamides, which were used as antibacterial treatments in the 1930s. Now, they're still used today in some antibiotics, diuretics, and anticonvulsants. Sulfur drugs contain a sulfonamide group attached to an aromatic ring. An example is the antibiotic Bactrim. Now, these sulfonamides, which are not used in general dental practice, are used for various infections and conditions, and they work by inhibiting a bacterial enzyme which is essential for the production of folic acid in bacteria. Allergic reactions to sulfonamides can occur, but the response is due to the immune system recognizing the sulfonamide group as harmful. Now, this reaction is not related to the sulfur atom itself, but to the whole molecular structure. So, in relation to your daily dental practice, there are generally no drugs that a general dentist would use that contain a sulfur group. So there is no need for concern, assuming you have confirmed that the allergy was to the sulfur drugs. Okay, and finally, sulfites, which chemically consist of one sulfur atom centrally bonded to 3 oxygen atoms. Now, these are used as preservatives in many foods, including wine, processed foods, and condiments. They prevent spoilage and maintain color, but can trigger allergic reactions, especially in atopic people who suffer from asthma. In relation to the practice of dentistry, sulfites are used in dental local anesthetics, which contain adrenaline, to prevent oxidation of the adrenaline. Now, let's just explore this a little bit. As we all know, adrenaline is a very effective vasoconstrictor, which means it constricts blood vessels. This action is beneficial in dental procedures because it reduces bleeding in the area where the anesthetic is applied, leading to a clearer surgical field and prolonged anesthetic action. However, adrenaline is chemically unstable and can be easily oxidized, especially when exposed to air or light. Sulfites, such as sodium metabisulfite, act as antioxidants. They basically work by undergoing oxidation themselves, thus sparing the adrenaline molecule from being oxidized. This helps maintain the stability and efficacy of the adrenaline in the anesthetic solution. Now, if someone is allergic to sulfites, adrenaline-containing local anesthetics should not be used. Now, in conclusion, the term sulfur allergy is a bit confusing, and a more detailed description of the patient's allergic experience should be performed. What we really want to know is the specific name of the drug or drugs to which the patient reacted, the nature of the reaction, what exactly happened, and when it occurred. You will sometimes find that so-called allergic reactions were not in fact allergic responses at all, but other adverse drug reactions such as gastrointestinal upset from antibiotics. Now, these reactions are not immune mediated and are dose dependent. So the key points from a dental treatment perspective are: 1, if a patient reports they're allergic to sulfur drugs and your questioning confirms this, that is, for example, they're allergic to the antibiotic Bactrim, which is a sulfonamide, then this should not affect your treatment of the patient. You're fine to use all local anesthetics, including articaine and adrenaline-containing local anesthetics. 2, the only relevant finding is if they have a definite sulfite allergy. In this case, avoid adrenaline-containing local anesthetics or any other drugs that may contain sulfites. And 3, it's good to know that there is no cross-reactivity between sulfur drugs and sulfites. So if a patient is allergic to sulfur drugs, this does not automatically mean they are allergic to sulfites as well. So thank you for watching. I hope you found this video helpful, and if you did, please like, share and subscribe for more informative content. Leave your questions and comments below. See you next time. Thank you.